Hey guys, so I'm super sorry that I couldn't be there with you today. This is my first time doing something virtually, um, so it should be interesting. Bear with me if you want to see the best part. It's the fact that I can do this in my PJs. Okay, so yeah, I'm still in my PJs. Be jealous. So today I'm celebrating a late Thanksgiving with some family, so I decided to pre-tape this. I do encourage you all to tweet me at x Corey CoreyDX with any questions that you might have, and I'll be happy to respond. Funny thing about Nicole and I is that we actually haven't met in person, but we've been friends for a long time. She's been a great comrade and a great teacher to me. And it kind of speaks to the powerfulness of social media. So a little bit about myself quickly is that when I was doing my poli-sci degree at Carleton University, I got an opportunity with public health to be a youth facilitator where I was able to go into high schools with public health nurses and implement nutrition programs and healthy living programs around physical activity as well, in addition to nutrition in the high schools. So shortly after I graduated, I was always kind of fascinated with communications and especially social media. So I approached the public health communications group at Ottawa Public Health and received an opportunity there and kind of never looked back. Currently, I'm working at Ottawa Fire Services for the fire chief. I'm doing a lot of strategic work there and starting to implement some social media stuff that I'll get to a little bit later. So let's kind of get started, and I'll kind of tell I thought it would be useful if I told the Ottawa Public Health story because I know Nicole and I really wanted to concentrate on being useful, and I do think the story is relevant. So I'll start off with that. The way OPH is what I'll refer to Ottawa Public Health as, so I don't have to start stumbling over my words as much as I already do. But OPH got started online throughout H1N1 when they were looking for an opportunity to notify residents and about wait times and clinic locations. So their followership grew drastically after they opened an account up. And I think the answer there is simple, is that the content was extremely relevant for one, and it was extremely useful. So, like people on the bus ride home, people, like I said, people on the bus ride home, people like could check quickly before dinner time while they were swooping. Like, you know what I mean? Like residents were able to check wherever they were, what the times and locations were for the clinics. So that was it was interesting to see how quickly the followership grew. Post H1N1 though, OPH was kind of left with this followership and they kind of had an opportunity, and I'm sure you all know the many opportunities that social media brings, such as it gives you direct access to residents, gives you the ability to alert media, and to influence users about your message. So we quickly started exploring with Twitter and Facebook, and it was very much primarily based on outgoing messaging. So stuff like event details, news releases, and canned public health messaging. So our followers weren't growing nearly as fast as they were throughout H1N1. And why? Well, again, I think the answer is pretty simple, and it's that although the information that we were sending might have been useful, we weren't necessarily communicating it in the most useful way. So we first kind of had to take a step back and say, like, why are we using social media beyond having direct access to residents and to media? So we kind of came up with a couple things. Those couple things were that social media is here to stay. You know what I mean? Facebook has over 1 billion. Twitter has over like 500 some million users. I don't know how up to date those numbers are, but people are using it, and people are using it on a daily, hourly, almost like minute basis. You know what I mean? People trust their friends, and what I mean by that is that brands need to somehow get into the minds and the words of the public. I know for me, if I like Nike can send me, I might see the most elaborate Nike shoe on television, and it's a television commercial around this new revolutionary shoe. But until my friends come up and tell me how incredible this shoe is, I probably won't even contemplate buying it. Do you know what I mean? That's where that trust piece kind of comes in. So how do you get into the minds and the word of mouth? And a lot of that is through online now and building up community. Building up a community, because that's kind of your best promotion is word of mouth. Um, Brands don't necessarily need the big dollars anymore or those celebrity endorsements. It's all kind of online engagement. That's kind of where you're seeing the shift going. So it was important for us to be a part of that. People are talking about you online, whether you're listening or not. So you're either kind of taking that opportunity to engage with these people and maybe dispel any myths that they might be sending out about you, or on the other side, if they are sending out positive stuff, it gives you that opportunity to thank them and reward them for it. And push that messaging out. Whether it's just through the retweet button, so people are seeing that people think positive about you, and that's building that trust, amongst friends. So I already kind of talked about creating word of mouth. It's the best form of promotion. It's also an opportunity to manage your reputation. So if something is going on out in the community that affects public health or for any business, Twitter gives you that opportunity to be at the forefront of issues or things that are going on. I often use the example of boil water advisories within Ottawa for our public health unit there. It's kind of difficult to get the information out quickly, but now with Twitter, you're able to say that, if there's a boil water advisory in a small community, you can send that tweet out instantly without having to wait for layers and layers of information or approvals and translation or whatnot. We're able to just kind of send something out quickly and get the information out there while we wait for more information. You're able to kind of build a community and followership. You often have public health staff in the community and interacting with residents, so why aren't we doing it online? And then there's analytics, right? I mean, the example I like to use is with a poster in a community center. There is a balance between using new media and traditional media, but the example I like to give with analytics is you can put a poster up in a community center, and you can sit in that community center and kind of put a check mark next to every time somebody looks at the poster and reads it throughout. You can put half a check mark every time somebody walks by, looks at the poster, reads half of it and leaves. Or you can put an X every time somebody just walks by and ignores it. Or you can send out a tweet and you can find out how many people are clicking on your information, how much time they're spending on that page, and which region they're clicking on it from, what demographic they sit in. And you can really start targeting your messaging. So that's kind of the benefit, right? So then after we did that exercise, we kind of asked ourselves, how do you become useful? And decided that incorporating some of the key tactics that we just kind of talked about into our content and our use of social media was our way to go. So we started kind of basing our strategy on two-way conversation instead of that one-way promotional kind of unilateral, if I could say that, approach. So we started creating relationships that were based on dialogue and not just providing that information in a robotic way. So how are we going to become so engaging? And that was what we based our strategy on. So I think right off the top, it's important to understand your audience, like who is, and this speaks to analytics that I just spoke about, like who is clicking on your links, at what time of the day are people looking at our info, and what demographic are they? So we knew on our Facebook page that it was primarily females between the ages of 30 and 35. So we could almost assume, and knowing that our prenatal and healthy pregnancy messaging was doing the best, we were able to kind of target our messaging there throughout certain times in the day. and primarily put out information that was relevant to females between the ages of 30 and 35. So that's one way that we were able to understand our audience and kind of key into certain engagement opportunities there. In terms of the times of day, you're not going to tweet out healthy meal ideas at 4 in the morning. You might want to tweet them out at 4:30 in the afternoon, 5 o'clock throughout rush hour when busy moms and dads are on the bus ride home. Because they need those quick meal ideas before they get the kids off to gymnastics or soccer or hockey, whatever extracurricular activities they're doing. So, it's important to start shifting your messaging around that audience. It's also important to create original content. So, like I said briefly, to not be robotic, you have to stand out from the crowd in some sense. So, instead of your message reading, hey, there's an event tomorrow at City Hall, 4 p.m., about healthy living, you can be more engaging by saying, hey, what's your favorite healthy living tip? Come on down to City Hall, share some, and learn some. That's a much more engaging message. Kind of a lame example, but you kind of get my point there. It's important to increase linkability. And I think linkability is a word that I just made up, but I guess I'm trying to think of a better word for that is like cross-posting. So you have to find a way to create the same message uniquely across the platforms that you're using. So if you're sending out a message around let's say your tobacco cessation programming on a blog, you might have a more elaborate post. Whereas, and you can do the same on Facebook. Whereas on Twitter, you have to kind of find that key point that's going to engage people to kind of go to that link. So that's what I mean by linkability, is that kind of cross-posting. You got to make sharing easy. So what we talked about was writing clean content, so using programs like Hootsuite and such to shorten our links, to be an effective hashtagger, do our research, make sure that we're not using text spelling too much, so not using like the word for and like using the letter or the number for. And another key thing we talked about was empowering our people. So, like I said earlier, we have public health nurses and public health inspectors in the community that are building their own community relationships. So how do we do that online? So how do we empower our staff to use Twitter and Facebook and blogs to engage an online community that might be looking for the information? So we created a social media policy that was it wasn't heavy on rules and regulations. It was more around giving them ideas for content and tools that they can use, and offered up, a half-day training for them to kind of come in if they were interested to learn ways to do so and how to measure what they're sending out. So it's also important to be real and genuine. We all know about adding personality, making it seem like there's somebody behind the tweet, and that's as simple as like signing off on your tweets. Become useful. An example I like to use is we had a mother last year tweet that throughout the flu season we were effectively monitoring some key terms online, because not everybody in the community that use Twitter is going to mention you in your tweet, so you have to be able to listen well to engage users. So we were monitoring flu clinics, and a mother had tweeted that she was on her way to a high school for a clinic with a little one. So I quickly tweeted to her a link that has all the criteria for little ones that are eligible to get the vaccine, and it turns out that her child wasn't within the age limit. So she was able to kind of turn around and head home, and thanked us online for that extensively. So that's kind of an example of being useful, being real, being genuine, and being an effective listener online to provide yourself with some engagement opportunities. So OPH had already had this Twitter and Facebook account, and after our brainstorming sessions on how we could improve, we decided to open up a blog. We used Tumblr as a platform, and it was an easy decision for us because it allowed us to upload more content in a clean, user-friendly way. It gave us the ability to upload share buttons to increase linkability and sharing, create a conversation and engagement avenue for the public in a more public domain, I guess. On Twitter, sometimes it's it's difficult to follow the conversation unless you're having it directly with one or two people, whereas on a forum, you're kind of able to engage with multiple people and users. It gave staff a tool to start blogging, so we actually built up a schedule based on some staff that were really keen on blogging some of the work that they do and how they got into public health and how public health chives into their days, their family days, and the lives of their friends. So it kind of added that personality and gave a face to OPH. So we saw that since shifting that model to becoming more engaging, the OPH followership grew drastically. So that was kind of interesting. And now shifting into being in the emergency services realm, working at Ottawa Fire Services, I've kind of quickly realized how useful you can be on social media. Currently at Ottawa Fire Services, we're working up a social media strategy, and we have two personnel that really use Twitter in an effective way on a daily basis, and that's the chief, Fire Chief John DeHooge, and actually our Public Information Officer, Mark Messier, who's really his role is to engage media, develop relationships, and also share public education messaging and our fire prevention messaging as well. So Mark runs arguably one of the most useful Twitter accounts within Ottawa, and he tweets like fire prevention messaging, public education campaigns, but in addition what he's doing is he tweets highly operational information as it takes place on the scene. So looking at his account right now, which is Ottawa Fire PIO. So he's at Ottawa Fire PIO if you want to check it out. And I'm just looking for an example here. So here's a good one. Yesterday, which would be the Friday before this conference, so October 18th, we had a hazardous material call. So we call that hazmat. So as soon as the dispatch call comes in, Mark tweets that hashtag #OttFire hazmat responding to, and he gives out an address because workers at the building are reporting symptoms. So that actually received 7 retweets, 5 of them being major news outlets. The next tweet is the building's being evacuated, 8 persons reporting symptoms. Hazmat suits are going on, entering the building to take samples. The tweets go on and on as the situation progresses. States that he's actually putting his phone down to get on scene so he can coordinate media and answer questions. Taking numerous samples, nothing has been found so far, etc., etc. So this is what the community wants and what they need to hear, and it's all about being useful. And there's a ton of opportunities to do that within public health as well, throughout emergency response, throughout things like boil water advisory, as I mentioned, infection control, those types of things. That's one way in being useful. It's not just a promotion avenue. So I hope you found this interesting. Thanks so much for listening and attending our session. I'll pass it off to Nicole now, and she can continue again. If you have any questions, feel free to tweet me at XCoreyDX. Okay, see you now.